Hello, everyone. This is Screencast 1.2 for week number 1, and we're looking at Chapter 1, What is Epidemiology? So here is the course description. I'm not going to read through this, but basically what we're going to be doing in this class is exploring epidemiologic concepts and doing so in a way in which hopefully, if you wanted to, you could do an epidemiologic type of study for your dissertation. Or maybe you don't want to do that, but you see some future where you're able to do epidemiologic types of studies. And at a minimum, my goal for you is to be able to take a paper which has an epidemiologic study design to it, to be able to review it, critique it, and determine whether or not the information in that paper will have an impact upon your practice or your future research. So again, here's my contact information, and something that I did not include in the opening screencast for this week was a link to my ResearchGate page. Now, I don't put that there for purposes of having you go to take a look at my history. Rather, if you're not familiar with ResearchGate, it may be something that you want to set up for yourselves. It is a free social media site for researchers and academics. And so it places or provides a space for you to be able to upload your research work and to also access and communicate with other researchers. And it's just kind of a social media platform for researchers and academics. Here are some recent publications of mine. And in the last screencast for this week, I'm going to illustrate how one epidemiologic study design can potentially lead to numerous papers. So a lot of my work the past few years have been in the area of epi and volleyball players, and we see a couple samples listed there. And then another area that I'm really interested in is blood flow restriction training. And so we see a couple different examples presented in this area. The past year or so, I haven't been doing much writing. I've been doing some research, but haven't been doing much writing because I've been focused on getting the second edition of this textbook out. And so that's coming out later this fall, I think late September sometime. So it'll be then time to transition back to getting some papers out. And that's what, you're trying to do here at Rocky Mountain University. You're learning how to become an academic, how to become a researcher, and it really is exciting and really is rewarding to get that first dissertation paper accepted, to get that first poster or platform presentation accepted. And my hope is, even if you're not interested in epidemiology in the long run, that I provide you some value in this class that helps you along your path towards achieving your future goals. Some things I've been currently working on. We published a paper looking at prevalence of patellar tendinopathy in a 1-year cohort of basketball players. We also collected data the second year, so going to be doing something soon where I'm looking to see, were the trends similar year to year? Were there differences? Were those people that we assessed both years, did they have patellar tendinopathy both years? So what was the percentages there? So just something I'm going to get to in the near future. The next one here, blood flow restriction training. So I've been trying to make BFR work for the rotator cuff. And for those of you who know anything about blood flow restriction training, you apply the occlusion cuff to the upper arm or to the upper leg, and anything that's distal to cuff application gets that blood flow restriction training effect. Researchers are also finding proximal benefits. And so potentially based upon some of these underlying mechanisms, there are potential ways to get the hip stronger, to get the low back stronger, to get the rotator cuff stronger. I published a couple papers first looking at application to the upper arm and not having any difference between groups. Another one was doing one leg, so exercising with the leg under occlusion or not, and then seeing if the rotator cuff got stronger with the particular shoulder exercise program that I had in place, and it didn't. But this one's really kind of exciting. And so what we had people do here is they were bicycling for 10 minutes with occlusion cuffs applied to both thighs. They were riding the bike at 40% of their heart rate reserve. So they were going very slow. And they did then bicycling at a slow speed with BFR or without BFR. And then they performed 3 sets of 15 of scaption and sideline external rotation. And those in the BFR group got significantly stronger. So kind of an exciting one there. That's going to be the first one I get to when I start writing again. And then looking at dietary habits of individuals with chronic health conditions. So very interesting area that I'm just kind of stepping into is more of the health promotion side of things. The past year, I've completed a couple different certificate courses at Rocky Mountain University. I'd highly recommend them. The functional nutrition certificate course program, as well as the health coaching program. I think there's great opportunities in the future for practitioners, whether they be PTs, nurse practitioners, PAs, people that work with individuals with chronic health conditions to potentially have a very positive impact looking at the whole person versus just what you typically do within your silo of work. All right, quick syllabus review again. There are going to be weekly homework assignments, and typically there is also going to be a discussion topic and or response. As I mentioned also in Screencast 1.1, you will have a presentation and poster assignment, which will be due around the middle of the term. And then at the end of the term, you're going to have the critique of an epidemiologic paper assignment and your epidemiology research study design paper. So the purpose of this first week is to become oriented to the course, understand the basic definition of epidemiology, and to evaluate your goals and expectations for this course. So our breakdown this week, and I'll include these breakdowns in each week and email you each week. That way you're kind of always prepared and knowing what's going on. 3 screencasts this week. Your reading is Barak et al., and it's not to read it to get to know it, but just to get familiar with the particular study design being demonstrated. And if you need to, check out chapter 1 in your textbook. Your assignment is a non-graded post. I want to get to know you, so please complete a biography, no more than 1 page, to include your clinical and academic background, future goals, research interests, and expectations for this course. All right, key messages of Chapter 1. Epidemiology is a fundamental science of public health. Epidemiology has made major contributions to improving population health. And if you get a free moment, check out that link there, 100 Objects That Shaped Public Health. It is really kind of interesting to look back, and things we take for granted now obviously haven't always been there. And so health has improved as we've understood causes of disease, risk factors for disease. Take, for example, the seatbelt. A great way to save lives during motor vehicle accidents. Cars didn't always have seatbelts. It was understanding that the risk of death or major injury could be reduced by wearing a seatbelt that has led to all cars having seatbelts. And then the continual advancement of trying to come up with other ways to save lives, whether those be airbags or other technology that alert you to cars nearby you. Epidemiology is essential to the process of identifying and mapping emerging diseases. And there is often a frustrating delay between acquiring epidemiologic evidence and applying this evidence to health policy. So, epidemiology is the study of disease occurrence in human populations by counting health-related events in people in relation to the naturally occurring groups of which they are members. So, some examples of epidemiologic studies: assessing risk of disease associated with smoking, looking at inactivity and disease risk, diseases associated with occupational chemical exposure, musculoskeletal injury risk in sport, and of course, what we have all come through is looking at COVID-19 and how often were epidemiologists talked about or interviewed during those early days in 2020, and in trying to understand how the disease was transmitted and how to reduce the transmission rate, or who was at greater risk of death if they got COVID-19. Epi stuff is everywhere, and the more that you're aware or thinking about epi, you'll start to see things. And this is really interesting. This came out last year. The association of sitting time with mortality and cardiovascular events in high income, middle income, and low income countries. I think we're really starting to appreciate that lack of physical activity is killing us. And excessive sitting time appears to be a global problem. And the researchers of that study, they found that even those in lower income countries may be at a greater risk. So just kind of interesting. And again, my whole purpose of illustrating this was to highlight that the more you're aware of epi, the more you're going to see it. Where does epi fall on the spectrum of research? Well, it occurs both under the experimental and non-experimental side of things. When we talk about an experimental design, we think about something like a randomized controlled trial, right? Well, how could epi fit in there? For example, those of you who are physical therapists or athletic trainers, you may be familiar with the injury prevention programs for female athletes. The whole purpose of these are to reduce the risk of traumatic knee injuries. Well, there was a paper published many years ago, I believe in 1991, by Tim Hewitt et al. In the American Journal of Sports Medicine. And they compared three groups. They compared females who received the training program to a cohort of females who did not receive the training program, but just did their usual training, and then a cohort of males who also did their usual training and did not receive the program. And it was a randomized controlled trial design. The people that were the female athletes, they were randomized, I believe, by team. And so one group had 400 some athletes, another group had 300 some athletes. So there were these very large groups, and there was that randomization that had occurred. What was epi about it was that they showed that there was a reduction in the number of ACL injuries in the female athletes who had gone through the training program. So they were able to utilize epi-related statistics to show that risk reduction. And they presented basic epi information looking at who the athletes were who got hurt and what their injuries were. A lot of other epidemiologic work falls under the non-experimental side, and we'll see examples of these in the coming weeks. Observational epi is where we're going to see the cohort designs, like the prospective listed there, as well as case control. And then there is descriptive epi. Cross-sectional will make a lot of sense. Case reports. Case reports can be epi in nature. And again, we'll show examples as the term goes on. Hippocrates observed more than 2,000 years ago that environmental factors influence the occurrence of disease. Hippocrates not cited as the first epidemiologist. That title goes to John Snow. And John Snow was involved with the cholera epidemic. So between the years of 1848 and 1849, and then again 1853 and 1854, Snow conducted the first epidemiologic experiment and was looking to see why or maybe where people were getting the disease from. And they found that the risk of cholera in London was related to drinking water supplied by a particular company. So they located the home of each person who died from cholera during the time period. And he noted an association between drinking water source and deaths. The number of deaths and the rate of death were higher among those who were supplied water by the South Wark Company. So this is an example of epi at work. Some other contemporary examples of epidemiology, again, kind of touched on these in a previous slide. Cigarette smoking and cancer, HIV/AIDS, viruses like COVID-19, hip fractures. What are the risk factors for somebody sustaining a risk fracture? Why is that important to know? Well, it's important to know because when somebody has a hip fracture, there is often a decline in health that goes along with that. And some number, I believe it's around 1 in 3, will pass within a 6-month to 1-year time period. And then, of course, looking at ACL injuries in female athletes. So epidemiology, the study of the distribution and determinants of health-related states or events in specified populations, and the application of this study to the prevention and control of health problems. So those doing epidemiologic research are interested in death and illness and disability, as well as injury, as well as mental health. And they're also interested in positive states of health and means to improve health. So it's not just always you're at an increased risk of injury, you're at an increased risk of death. What are things that can promote life, reduce the risk of death, reduce the risk of disease? A focus of epi study is the population defined in geographical or other terms. For example, a specific group of hospital patients, or factory workers, or Division III college athletes. These could be the unit of study. A common population used in epi is one selected from a specific area or country at a specific time. This forms the basis for defining subgroups with respect to sex, age group, or ethnicity. Here are some additional terms that help to define epidemiology. I'm not going to read through each of these here, but I would invite you to pause the recording and take a quick look to make sure those things make sense to you. Public health, this refers to collective actions to improve population health. Epidemiology is the research tool used to facilitate improving health. Thus, epidemiology is a basic medical science with the goal of improving the health of populations, especially those who are disadvantaged. So let's take a look at some additional concepts related to epidemiologic research. Causation of disease. This is the attempt to identify environmental and/or genetic factors that cause the disease. What's the natural history of disease? This is concerned with the course and outcome of a disease. For example, acute low back pain. This can potentially get better in people after 6 weeks or so. Adhesive capsulitis or frozen shoulder. Without treatment, many people get restoration of their range of motion and a decrease in their pain after 1 to 3 years. Epidemiology is often used to describe the health status of population groups. Knowledge of the disease burden in populations is essential for health authorities. They seek to use limited resources to the best possible effect by identifying health programs for prevention and care. What's another example? Well, if you are an administrator at a university, you may be interested in the mental health status of collegiate freshmen. Why? Well, you want people to start off school, to have success, to feel like they're fitting in, that they're connecting, and that will potentially help with retention. People coming back after the first term and continuing on. Well, if you could identify risk factors which could help reduce the anxiety caused by individuals or reduce the depression rates that are caused leaving home, going someplace new, that could be very beneficial. Epidemiology looks to evaluate the effectiveness of interventions. So, what do we mean by this? How good is the health service that a hospital provided or that you provided in your clinic? Does it reduce the length of stay in the hospital? So that would be evaluating an intervention. Let's think outside of that kind of traditional healthcare model. What about reducing lead additives in gas? How does that affect the health of the population? So it doesn't always have to be something, because again, think public health doesn't have to always be something within the traditional medical model and how we deliver our services to people. It can be something outside of that. Now, the remainder of the chapter presents some achievements in epidemiology looking at many of these conditions. It is interesting if you want to read through it. It's a short chapter, but nothing that we need to be concerned with for this week's material or for future stuff. A lot of it is just kind of highlighting some of those major accomplishments. So I'd like you to review the Barak et al. Article, and I'll discuss aspects of this paper in Screencast 2. Please complete the biography forum and go on to Screencast 1.3.